Hi, everybody. Hi, Maria. Okay, here we are again, Tuesday, happy hour Q&A. Okay, sorry, I'm a little bit behind today. Hi. Okay, so happy Tuesday, everybody. Our topic for this week is breast augmentation. Oh, I'm seeing some people that I've known from Providence, Rhode Island. Hi, hi, hi. Lots of new people. Ooh, yeah, thank you. This is my new scrub color. It's, I think, coral. I'm kind of a fan. But it feels really springy, kind of happy, and I'm in a good mood today. Got to work a little bit, do some skin cancer closures, and I feel productive again. So that is exciting. Hope you guys all are having a good start to the week. The weather in California is beautiful. So I know everyone's itching to get outside and, start life again. But I'm glad we're all being safe. I'm glad we're kind of past the peak. And now we're starting to plan to open again, which we're all really happy about. Hello, hello, wave, wave. Oops, what did I just do? Oh, okay. So, again, like I said, today's happy hour Q&A topic is breast augmentation, and our cocktail mocktail today is a spicy grapefruit margarita. Kind of figured it's getting towards Cinco de Mayo, everyone's feeling a little festive, and this drink works for me. So, again, because I'm trying to make this family friendly and all ages, we're going to do the mocktail version, but unlike the previous 2 weeks where the mocktail was fairly different from the cocktail, this one is pretty much exactly the same, except I'm going to leave out the tequila. Feel free to add in your own, but for me, we're going to skip that. Let's see. Okay, so I haven't had a chance to practice this yet. Right. Glass. Okay, so it says I need to take a hatch chili, and I said, what the heck is a hatch chili? I don't know what that is, but I do have a serrano and my trusty Cutco knife. So it says to cut it into 1/4-inch rounds. I don't know how many rounds. I guess it depends on how spicy you want it. I like my drinks okay spicy. Let's put a couple of these in there. They're so cute. So I'll put a couple in there. If I start sweating or kind of disappear for a little bit, you'll know why. And then we're supposed to muddle. So I'm going to use my little mortar, pestle. Okay, anyhow. Sorry, like I said, running a little bit late, in a good mood, so that makes me a little bit silly. Okay, so I'm going to muddle this stuff. Oh, I forgot a step. Okay, we're supposed to coat the rim. Usually when I drink my margaritas, I don't really like salt on the rim, but since we're trying this, I figured we'd do it. This one is for Monique, if you're watching, because you girls in my Upland office love this, how do you even say this? Tahine? Anyhow, it's apparently really good with fresh fruit. We have it. My husband kind of eats it. I don't really know what to do with it, but I will try it. So it's good for using to rim the glass if you don't have salt and chili powder, I think they were asking for. That's true. I kind of prefer just to have nothing around the rim, but sugar can sometimes be good. I like those with like a lemon drop type of drink. I think the sugar is nice, but the salty and the citrus and so not so much my thing. Okay, so it also says to use a grapefruit. I have a pomelo, because I like pomelos and I didn't have a grapefruit, so we're going to use that. Oh, my knife is not big enough, but I will cut this in half. And okay, maybe a little bit overkill right now, but I'm going to rim my glass with an enormous pomelo. Woo! Okay. And then I'm gonna, get the stuff on it, make it look all legit and pretty. Oh, that looks nice. Pepper, get back in there. Okay, so So again, muddle, muddle, muddle. Remind me not to rub my eyes because that might hurt. All right, next I get some ice. Okay, I've got my ice, and now they say you're supposed to squeeze in a whole lot of fresh grapefruit juice. Again, I'm using a pomelo because I don't have grapefruit, and I like pomelo, and I find it's kind of similar to a grapefruit. Feel free to disagree with me if you want. And again, I don't have a mixing glass because I keep forgetting. But I do have a handy baby bottle, and they have all the little gradations on the side. Now, 3 ounces of, let's see, more waving. Wave, wave, wave. 3 ounces into my handy glass. Ooh, this one is a super juicy pomelo, which I think will mean that this is going to taste amazing. I'm pretty excited. We have a grapefruit tree at our new house, but I can't reach, so they're just sitting up in the tree. Unfortunately, I need one of those things with the like that little apple picking thing where you get the apples out of the tree. I need one of those. All right, making a big mess here, but that's okay. I'm at home and no one's judging me, right? This is 3 ounces. I am at about 2 and a bit. So this might actually take up my whole pomelo, surprisingly enough. That's too bad. I was hoping I could eat some of it after. That's okay. I guess I'll just drink it instead. Hi, Veronica. Okay. This is more work intensive than I expected. Maybe you could buy freshly squeezed grapefruit juice if you're lazier. And I do like the taste of fresh, and I love pulp. Huge fan of pulp. If my drink is pulpy, it's by choice. You can strain yours out. Okay, almost there. I'm like a couple cc's away. Okay, lost about an ounce just making a mess. Okay, here's my fresh juice that's going in. Oh, dripping all over the place. Awesome. Okay. So I don't really know why they said I have to use fresh grapefruit juice, but I can use store-bought limeade. So, but fortunately, I love limeade. So here's limeade. 3 ounces of this, again, into my trusty baby bottle. 3 ounces. There you go in. Ooh, that's looking good. And 3 ounces of some kind of sparkling something. So I have citrus. Thank you, Whole Foods. This is actually a fairly high volume beverage. Everything else I've made has been like 2 ounces, but this is a good like 10 plus ounces. Good thing I have a double whiskey glass here. Alright, and then this is going in. Pretty much takes it right to the top. Okay. And give it a quick little stir. Yes, I'm doing it with my knife. I do a lot of things with my knife. I kind of think if I just had chopsticks and a knife, maybe a spoon, but I could pretty much do anything. Hi, Amanda. Okay, here it is. I think it looks pretty good. Let's see. The little chili's gonna float on top, make it look pretty legitimate. And like I said, if you wanted to make this an adult beverage, you can just add 1.5 ounces of tequila of your choice. So cheers, let's try it. That's pretty darn good. I can see why they would like the grapefruit over the pomelo, just because the bitterness I think would give it a little bit more depth. So next time I'll try and get a real grapefruit. Okay, so that mess aside, so on another note, have any of you guys been to Chicago? Or Dave, I know you're from Chicago, and my husband used to live there. He lived there for about 9 years. He did his college there and then his residency. And I got to visit him kind of in that latter half of stuff, and he introduced me to Luminati's Chicago pizza. So we ordered 6 of these, and they just arrived today, and we are going to gorge ourselves on pizza. So just so you know what it looks like, comes like this. I'm just going to stick this in the oven, and then we can talk about breast augmentation. All right. You guys are more than welcome to come over for pizza. Okay, breast augmentation, back on topic. The first couple of weeks we did fat transfer to the buttocks, and then we did labiaplasty. So now we're kind of moving up from the bottom half of the body up closer to the torso, and what self-respecting plastic surgeon does not talk about breast, right? Okay, so let's talk about breast. Sorry, it's a little sticky. Breast augmentation used to be the #1 elective plastic cosmetic surgical procedure in America, and it's still in the top 3. I think it's been overtaken by liposuction and body contouring. But you can imagine, of all the people out there who are considering procedures, that is one of the most common procedures, and not just the breast augmentation, because remember, if you have implants placed in your, say, 20s or 30s, it's almost a guarantee that at least one more time in your lifetime you will have a secondary breast surgery. Not because of complications necessarily, but because as we age, the breast tissue tends to sag and droop. Or if we have children after we did the initial augmentation, you might notice that the implants stay high, but then, you have that kind of Snoopy waterfall effect and things look deflated. So you want to fill them back up again. Or again, as we age and the skin gets loose and things start to go south, we need a little pick-me-up. So at that point, you may say, swap out the implants, I want some more cleavage, and also do a lift. Today, we're sticking with the pretty basic breast augmentation. So breast augmentation, at the very, very most basic definition, means that you're taking an implant and placing it behind the breast tissue. Now, in America, the majority of surgeons place these implants, and this is a gummy bear implant, underneath the pectoralis muscle, and that's your large chest muscle. When you're doing chest exercises, that's pretty much what you're focusing on. In other countries, you may see more of a preference for placing it on top of the muscle or under the fascia, but again, because we're in America, I will focus on subpectoral or submuscular augmentation. Now, there are people out there from America who have implants on top of the muscle, and I will do this on occasion, say for someone who's a bodybuilder, for whom it's very important that they continue to work out the muscles, or someone who just has a lot of natural breast tissue or a lot of fatty tissue, and I'm not so worried about the implant. But in general, we do prefer to put them under the muscle, and the reason for this is that studies have shown that it has a significant decrease in the incidence of capsular contracture, which is kind of scar formation and crumpling and tightening around the implant. Now, this is a known issue with any implant, and it used to be that manufacturers would say that the rate ran from anywhere from 5 to 15% in a primary augmentation, which means the first time you have implants placed into your body. Now, when I talk to my colleagues, most of us would say that our percentage of capsular contracture across the board is much lower than that, right, closer to the 2 to 5% range. But again, we do what we can to prevent complications, and that's one of the big things that we do. So when you come in for breast augmentation consultation, you are seen by our patient coordinators or my patient coordinator, and then you start your journey that way, and you kind of discuss your goals, a little bit about what happened to your own breast tissue, whether you were born without very much, like me, or if you've had children and everything is just very deflated, or if you lost a lot of weight and again everything's very deflated and there's a lot of extra skin. Hi. So these are all kind of reasons that women come in asking for breast implants. Now, once we've decided on the breast implant route, then we go ahead and talk about your goals in terms of volume and cleavage. So those are the two most important things that we want to know from you, and of your dream, your ideal size, and then also how much cleavage you want. So volume is a little bit tricky. If you go to Victoria's Secret versus if you go to Nordstrom and get yourself measured for a bra, the numbers they give you could be vastly, vastly different. Someone like me going to Victoria's Secret, again, yeah, not much there. They probably still tell me that I'm like a C cup or something, and I'd be like, you're insane. There's no way. I'm like an A cup on a good day. So that all varies. As a surgeon, we look at it in terms of volume, and I know a lot of you who've done research or have implants talk about the number of cc's, which just means how many milliliters of gel are inside this fill, and that gives you a rough approximate of what size. Now, this is not a definitive number, and I don't like people that get fixated on numbers, because a certain number on me, I'm 5 feet, 100 pounds, versus someone who's 5'8" and 150 pounds is a very different look, okay? So for me, an implant, and this is roughly 365. This is a fair size implant on me. I could get myself up to like a full C, maybe a small D with this. But in someone 8 inches taller than me, this would be like a little bitty B. Now again, I don't want you to get fixated on, oh, my sister's here, hi Yan. I don't want you to get fixated on numbers, and what I typically recommend you do is to look online, look on social media, and look for breast pictures. Now, of course, naked breast pictures are the most useful. You don't want the, squeezed together, selfie shot, lots of what looks like cleavage but may in fact not be. Now, that's one thing. Look for a picture with the size that you like. And the second thing I want you to look for is cleavage. Now, cleavage is not what you can hold between your breasts. I don't care if you can put, like my serrano pepper in there. But what I want to know more is how much of that roundness do you want to see when you're looking down at yourself without a bra on? Now, I'm not talking about the push-up look. Anyone can get that with a push-up bra, but just you looking down, how much roundness do you want? And based on that, we're able to pick, again, sort of a size, but also a profile. So again, a little bit of implant education. Implants come in different volumes, which means that there is more gel in the fill, and then they also come in different profiles. So which means that when you look at it from the side like this, or when you're wearing it on the side like this, how much does it stick out from the wall of your chest? Not from the breast, because I'm putting this on top of my skin, but once it's underneath the skin and the muscle, how much will that help your breast to come out this way? And taking into consideration your measurements, which I do during the consultation, which really is important for how wide your natural breast is, as well as how far down or how droopy your nipples are compared to someone who is just straight in. These are all things that are taken into consideration to determine the size that you would need to be in order to get to the goal that you want. Hello. All right, so once we start looking at your wish pics, take your measurements, talk about your goals, then we talk about the surgery itself. So a breast augmentation is fairly straightforward. It takes about an hour start to finish, and the couple of decisions that we have to make together are where you want your incision. So again, in America, the most common incision for breast augmentation is to put it underneath the breast so that it's hidden in the crease of the breast. Now, this is not necessarily the crease that you currently have on your own breast, because remember, augmentation means that most of the time we're adding volume and we're filling it up. So that may change as we're doing our decision making. But that's something that I mark out very carefully on the day of surgery, where your new crease will be. And I place that scar in there so that it's hidden, and that when you're wearing your itty bitty teeny bikini, no one will know that you've had an augmentation. The incision, if I place it underneath the breast in the crease here, is about 4 centimeters if it's a gummy bear implant. For people who are looking for the larger volume implants, and right now implants go up to 800 cc's if we're talking about the gummy bear, I may or may not use a Keller funnel. Now, Keller funnel is essentially just like a plastic sleeve, and you put the implant in there, and I think of it kind of like a pastry bag, and then you just squeeze it and it slips right in, and it's a wonderful thing. But it is a little bit more expensive, so for people who are smaller and moderate, don't really need that, and we can still fit it in through that tiny incision. So that's the most common in America, is underneath the breast. Now, there are a couple other ways that we can place breast implants. Some people, if they have larger areola, which is the pigmented portion around your nipple, you can place the incision around the edge of the nipple, either on the bottom portion or the top portion. If you're someone who is prone to keloiding or bad scarring, sometimes I don't recommend this, but interestingly enough, there have been studies done in Asia, and this is the preferred location for Asian augmentations, is around the nipple. It's roughly the same size and the same idea. Go in there, put the implant underneath the muscle. They tend to heal fairly well for most people. After that, you can also have an incision in your armpit. This is actually how I was trained, both at Brown, where I did my residency, and then also with Dr. Daniel Mills in Laguna Beach, where I did my fellowship. So this means that the incision is hidden in a crease in your armpit. It's called a transaxillary incision. And doing this, we make a little tunnel right under this portion of the pectoralis major muscle, and then again, slip the implant in there into the pocket that we've created. Sometimes it's a little bit more difficult to get a very large implant in through the armpit, and if that's the case, I might recommend something a little bit different. But again, this is a discussion that you and I have, and we go through the pros and cons and sort of what your goals are in terms of what you want to wear, where you want to be seen, and how you feel about scarring. There's a couple of other techniques that people use that aren't quite as common anymore. There used to be a transumbilical or a tuba breast augmentation, where you place the implant through the belly button, and some people still do this. Essentially, you have to be using a saline implant. So you roll it into a little taco and fit it through the belly button. You can imagine trying to fit something this big through the belly button is probably not the best idea, but they can look very nice. And then after that, there are some surgeons, and I trained with one of the best, Dr. Richard Zenowitz, who likes to place his implants during a mommy makeover through the abdominoplasty or tummy tuck portion and straight into the pocket. That way you don't have any scars on the breast at all, and it's a fantastic method if this is something that you're interested in when you're talking about mommy makeover. Hi, Momo. So we've talked about incision. We've talked about how to decide what your goal is, and you and I, we talk about sizing together. And then the technique itself during the surgery, like I said, what I do is I go in, go down to the chest wall, which means I'm going through the breast tissue and the fat until I find the chest muscle, the pectoralis major muscle. And at this point, trying not to disrupt too much of this bottom here so there's still support and you don't have the implant fall too low, dissect the muscle and lift it up. And it's actually a very nice avascular plane, which means that it does not bleed. It's almost like it was made for an implant. And lift that muscle up, create that pocket, just to the size of the implant I want to place. Never dissect out too far on the side, because even though a lot of people say they like side boob is something that will happen to anyone who has implants down the road, just from the way the muscle tends to work. So, and then put the implant in there. Always rinse with a triple antibiotic irrigation to make sure that there's no bacteria in there and that we don't increase any risk of the scar formation or capsular contracture. Once that's in, stitch you up. I do like to use sizers so you can get to the right size, what you do is put your pictures on the wall, your pictures and your wish pictures, and then the whole OR staff, we vote. We say, hey, that looks amazing, or yeah, I don't think so. And the girls that I worked with in the Upland office, most of the time they were like a bigger, 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 bigger. And versus my Newport office where people say, let's look more natural. I just want to look really cute in a Lululemon bra when I go to yoga. So different wishes, different things. That's why we put the picture of what you want there and we gauge it on that. Now, once the implant is in, and we sit you up, make sure everything looks good, put you back down, swap them for the actual implant, touching it as little as possible. Again, don't want to contaminate that pocket, and then close up. And then we're done. So it takes about an hour start to finish from when you start going under anesthesia to when you wake up in recovery. See you the next day because I do want to make sure that nothing has happened overnight. It feels very tight, like a lot of pressure. I kind of liken it to being engorged with milk when you're breastfeeding. And for those of you who have not breastfed, it's kind of like an elephant sitting on your chest, maybe. It only lasts for about 24 to 48 hours, and then as the muscle starts to relax and accommodate the implant, that will get much better. I do always prescribe you some pain medication as well as antibiotics just in case. Most of my patients are off of those medications by the second to third day. You can drive once you're off the pain medications. I do encourage you not to do any exercising for about 3 to 4 weeks, especially chest exercises. And in fact, if you can just avoid doing chest exercises from then on, it's probably the best. Again, if it's important to you, please let me know and we can talk about putting the implant on top of the muscle instead of under. Oh, I see my husband. Hello. So then that is basically it for the discussion. The hardest part, I think, for patients when they go through this process is that you have in your mind this dream of what it's going to be like. You're going to go into surgery and you're going to come out and you unwrap and it's going to look perfect from that moment. But in fact, it takes time. It can take up to 3 months and for some people longer than that before the implants settle into place, into the proper position. And during that time, it may be frustrating. There may be one that's higher than the other. We may have you doing a whole lot of massage to try to get those into the proper position. And you know, it can be disappointing in the beginning. You look at it and say, what the heck? This does not look right at all. It's sitting up under my chin. It looks all wonky and funky, and I feel like there's alien things in my body. But, you know, we always say, be patient, bear with us. We've done this before. Everything will be okay. And it is. There are rare instances where we do have to do a little revision down the road, usually about 6 to 12 months afterwards, if sometimes there's an implant that gets hung up a little bit, or if it's a little flat one place or the other, but this tends to be in the vast minority. Complications, not too much. Infection, I say less than 2%. Wound healing issue, again, probably less than 2%. Yeah, and then the capsular contracture that I talked about in the beginning. Oh, hi, Jan. Oh, I didn't know I could have guests on my live video. That's fun. I'll have to try that out sometime. Okay, let me take a look and see if there are any questions. No questions. Okay, or maybe I missed some because it's hard for me to multitask. My husband always says that I am not good at multitasking. Thanks, dear. Yeah, I want to drink some of this drink. Cheers again. Oh, I did want to show you one other thing. So, I don't do that many saline implants. They've just kind of fallen out of favor for most people. They are less expensive than silicone, so if budget is an issue, then this is something we could discuss. The gummy bear implants are warranted for life, so unless they break or you have a scar contracture complication, just leave them alone. It used to be said that you should replace them every 10 to 15 years, but now we've changed that. You don't need to replace them unless there's an issue or unless you want to go bigger or smaller. Now, that being said, when it comes to augmentation with implants or any implant surgery, I pretty much always recommend the gummy bears. over the salines. There are some people who don't want the gel in their bodies, and for those people, then yeah, saline is a good option. Now, one of the saline implants that I do like using is called the Ideal implant. And the Ideal implant was made by a board-certified plastic surgeon, and you should always make sure your surgeon is board-certified. But what he did was create this implant, and you have to keep him watered. It's like a plant. Okay. So this is the Ideal implant. Now, Ideal implant, the way they made it is that it's a saline implant that feels like a gel. And the way they do this is that there are 3 layers within this implant. So there's 3 layers, and between each of those layers of silicone shell are baffles. So imagine, just like a honeycomb. There's a honeycomb pattern in here. And there are little holes through all the baffles so that the saline, the liquid, can flow through, so that when you're touching it or when you're wearing it in your body, it looks and feels a lot like the gel. So side by side, these are about the same size. This is the gel, this is the saline, and they do, if you feel them with your eyes closed, feel fairly similar. And I do like to use this implant too. Oh look, my baby's here. Haha. This is baby bee. Hi baby. Look at her cute little boots. So we hear from our friends in Chicago that it's snowing there. She saw snow in Big Bear at Christmas. I'm not sure she liked it, but these cute little boots were from her cousin and aunt up in Oregon, and they're just too cute, and she kind of likes them. Okay, baby is about to do bedtime. Bye-bye. 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 She's all cute. All right. So that's pretty much what I wanted to cover for breast augmentation. Oh, I think I have a question. Let's see. Oh, good question, Monique. So we do, did you see that? Oh, must the patient wear a bra to sleep forever after getting implants? Always do suggest some sort of support to keep the implants front and center. Nobody wants pit-tit, which is a terrible term, but it kind of explains it. Nobody wants implants ending up in their armpits. And we have a lot of secondary surgeries that we see where patients have ended up with implants all the way out in their armpits, and then we have to do capsulorrhaphy, which is pocket tightening, to bring them back. And it's a pain in the behind for both the patient and the doctor, because it's pretty hard to fix and pretty hard to get it symmetrical and staying around. So implants, plastic surgery is an investment. You would take care of something that you spent money on, and this is your body. So this is something you want to carry out for many, many years, possibly for the rest of your life. And so if we say, please do wear some sort of supportive bra even when you're sleeping, try to listen to us. Of course, there's special occasions when you don't have to, but if you can, it would be very helpful. The type of bra, I should say, if you're small implants, you can use like a little shelf bra, bralette. If you're larger implants, I do say use something more supportive, kind of like a sports bra with the molded cups, not the type that smash your breast flat. Now, thank you for that question. All right. Any more questions? I think we're good. Okay, so we are at about the half-hour mark. Chen, we got Luminati's pizza, and it's in the oven. We're about to take it out, so I have to get out of here before, or as that's done. Otherwise, it's going to be cold, and it won't be good, and I'll be really disappointed, and I won't be happy with you. Just kidding. All right. So this video, I think we figured out how to save it so that you can view it again under my IGTV. And if you have any questions that I did not answer during this segment, please feel free to DM me, or you can take a look at my website and there are blogs there, photos there, kind of educational materials. We are doing virtual consults still. Looks like we might be opening up in early May. So, you know, people are starting to come in and call. So if you're interested, please do give us a call, and we would be more than happy to meet you and talk with you about your goals and what we can do to achieve them. Now, it was a lot of fun, again, with you guys tonight. We did the spicy grapefruit margarita, which in my case was a mocktail, and I used pomelo instead. I do recommend the grapefruit. And Monique, I did the tagine. I did that for you. Cheers. Hope you all have a great night. Stay safe, and I'll see you next week.